Hi, Dr. Sean Woods here, Healing Vibe, going through my book, teaching you how to heal yourselves, teaching you about this human body. Today we're talking about the diaphragm, and the reason why we are is, although it's not an organ of digestion, it is a muscle that is critical to digestion. It needs to be functioning properly. There needs to be free movement of it for digestion to happen properly. So the diaphragm is this muscle. It sits back along the back part of the spine and comes up through the rib cage and attaches to the front of the rib cage. Let me show you a quick picture of it here. Here's the diaphragm sitting here. Here's the lungs. That's the diaphragm there. It balloons across the whole upper to mid back there. And I showed you this picture earlier from the mesentery. This is a side view of the diaphragm. The diaphragm kind of attaches back into the spine and kind of comes to the front of the sternum there. And playing a critical role in digestion, because when it moves freely, it completely loosens up many of the digestive organs. We had talked previously about the stomach and how I would go into patients and I had to dig out knots in people's stomachs. Well, the diaphragm is sitting right behind that. And when you see knots and adhesions in stomachs, you're always going to find adhesions in the diaphragm too. And where do they come from? Well, they can come from physical injuries. They can come from chemical assaults, just eating the wrong foods and having the wrong food absorb into the diaphragm muscle. Emotional stress is a huge one. Diaphragmatic movement and lack of it is a big source of anxiety inside of the body, because when that balloon muscle can't completely inflate, you feel restricted. Digestion slows down. You feel like you can't get things done many times. Confusion can start to set in also. So this muscle, what it does is it separates the GI tract, the digestive organs, from the heart and the lungs. It's a major interface between the two and plays a critical role in the formation of our blood. So when we're eating our foods, the stomach, the small intestine, the colon, they're taking the essence of our food, the purities of our food, they're moving them to the spleen, and then as we breathe in, and the air mixes with these purities, it forms our blood, and kind of important to the human existence. So many times I'm telling my patients that they just have to simply breathe. There are dozens and hundreds of different breathing techniques out there. There's belly breathing, there's diaphragmatic breathing, there's upper respiratory breathing, there's nasal breathing. Awesome techniques out there, but many times we just have to remember to breathe. So the one technique that I teach in my book and I tell people to do every single day is simply breathe in as big as you can, hold that for a second, let those little restrictions and adhesions kind of relax, try to breathe in some more, hold that for a second, and then even try to breathe in more again. And if you can do 10 of those, you will completely get some major airflow flowing through the body, and you'll start to relax some of those digestive organs. And this is what it looks like. As you can see, I try to get as much air as I can. I want to create room for my lungs. I want to create room for my heart. I want to pull those digestive organs down and make sure I keep food moving through that. Prana, which many of the healing arts talk about, that air, prana, is the life force. And without air, nothing happens inside of the human body. And when you start the healing process, besides getting the body to move and eating clean foods, big, deep air breathing is vitally important to your success in restoring your health.